Hello students, welcome to Current Affair for State Services Exam series with Dr. Vivek Rana. Topic for today's discussion is from health section. There is a disease which is making headlines and for a change for all the right reasons. The World Health Organization has officially declared that Mpox is no longer public health emergency of international concern. Now, this disease made headlines couple of years back because when it created a temporary scare in multiple countries, because this pox series is more or less related to rashes appearing on body, high fever, lymph nodes getting affected, and it's since COVID outbreak of COVID-19, any viral disease which has suddenly outbreaked has more or less created panic among the masses. So it's from last we could see a couple of years now the cases have totally subsided. You rarely see and come across a news related to mpox, so it was almost an obvious decision that mpox is no longer a public threat at international level, because only diseases which are spread across multiple countries or are seeing epidemic rise in number of cases are declared diseases of public health concern. So, from state prelims perspective, whenever such disease is in news, you just have to mug up what are the causes, is there any reservoir, whether disease is a zoonotic or not, is there a vaccine treatment available, or some peculiar symptom which makes this disease a case study. So first and foremost, let's start with what exactly is the Mpox. Originally, this disease was called monkeypox, but WHO rectified its nomenclature to Mpox because of late we have seen that the current cases rarely are linked to the monkeys. Only in case of historical history, there was first human case when it was confirmed the monkey angle was involved. But of late, the disease is being transmitted from human to human. So it was technically not a right nomenclature to name a disease as monkeypox, because unnecessary stigma is created for the monkeys, and we have seen that people tend, when such disease outbreak, they tend to avoid or create unnecessary panic among the citizens. So basically, but still, if you will look at the history, disease is still pronounced as monkeypox. So the key word here is the causative agent is a viral disease. It's not a bacteria or fungal. It is a zoonotic. It means it carries the risk of being transmitted from particular animal to human being. So basically, they might try to shift a statement zoonotic, non-zoonotic one. So the name of the virus is more or less the monkeypox virus. The family is orthopox virus series. Now, important point is this is the same family, it belongs to pox viridae family, in which we have other diseases like smallpox, chickenpox. So this is what we have highlighted in the screens. Variola is the exact name of virus which causes smallpox, and then the cowpox virus as well. And if we could recollect biology's first lecture, we have seen the world's first ever successful vaccine was developed against smallpox by Edward Jenner. And with that discovery and promotion of vaccination, smallpox was one of the viral diseases which was not only eliminated from particular region, it was eradicated from the world. So that's another success story which you need to keep in mind. And the vaccines which have been developed for smallpox continue to be used in this particular series as well, because more or less they belong to the same pox viridae family. So make sure you are able to differentiate such diseases. Especially they might try to create a question in which they might try to confuse the viral diseases with the bacterial ones, or one in which we have a specific rash and high fever as their characteristic feature. Because a little time ago we also discussed about the measles and the German measles difference. That topic also more or less cater to the same, you could say, clinical symptoms of having the rash and fever. And as you could see on your screen, some specific rash papule lesions of nodes will appear because lymph nodes get swollen in this particular disease. And more or less, you will see the transmission is through face to face. It could be through direct physical contact. A person accidentally makes a contact with the infected part, more or less is likely to get contaminated through bleeding or any, you could say, saliva or blood secretion as well. So basically the physical contact has to be avoided in such diseases, because these diseases can easily transmit from one human being to another. Now, here's the important part from examination point of view, that why this disease was called initially the monkeypox and where exactly this outbreak started. So, this disease was first identified originally in monkeys way back in 1958 in Denmark. But initially we thought that it's like a swine, you could say fever or avian flu disease, which are limited only to pigs or you could say the birds. In this particular case, it was thought that it's the disease mainly linked to monkeys, but eventually the first ever human case was confirmed in 1970 in Africa, and the country was Democratic Republic of Congo. Now, Congo has a wrong reputation of lot of outbreaks. Even Ebola outbreak is indirectly linked to it. So more or less the broad reservoir term which comes into the picture is are the large mammals. Typically rodents and primates dominate the group. The monkey which we are just discovering in research or any other breed, they belong to the mammalian order of primates. So this is where the important part is. And typically the scratching, biting, consumption, hunting, these are some of the risk factors attributed, where a person who is in forest might come accidental contact with the infected monkey, and once the virus is transmitted to human, he himself can transmit to multiple humans and become a super spreader. So basically you just need to mug up and don't try to confuse this disease with Ebola. Ebola was another viral disease which had much higher fatality. It was named after river in Congo, because once you know this Congo, at times in mind the two diseases tend to get intermixed. Now, the symptoms are more or less on lines of other viral infectious diseases in which rash is the peculiar feature. So, first of all, whenever virus will enter into your body, initially the body will respond with high fever. So, fever, there will be mild pain in muscles or back, headache is also observed. And basically, the main characteristic feature is swollen lymph nodes, and that and person would feel dizziness, would feel low to his optimum, having malaise like symptoms, which they have simplified as low energy feature. And the rash would start on either face or genitals and spread to the rest of the body, and it the defining feature is even appears on palms and soles. Generally palms and soles are rarely we see rash on these particular parts, but in this case they might spread there too. And eventually, as you could see in your last image, they are start from a flat to blister, and eventually in the end stage they turn to scabbing feature as well. So basically you could say till the infectious period is there, the person is likely to isolate himself so that he should not transmit it to other members, because otherwise the cycle will continue, because viruses are nothing but obligate parasites. They need a definite living host to continue their journey, and unless that journey is completed, they are continue to multiply in the living individuals. So we can say this particular disease is finally no longer a public health concern. So the health authorities should be lauded for their effort for containing this viral spread globally now. And once again, in the summary part, we can say the symptoms have been highlighted, and once again, the scab node part which we are highlighting has been demonstrated, the rash with blisters. And prevention is more or less on lines of any viral disease. You should practice the best hygiene sanitation practices. The basic safety protocol is wash your hand periodically. The best remedy is isolation, because once you have isolated, there are less chances that you will transmit it to some another individual. And wearing a mask, because we have seen contact is the one reason, and typically the coughing, sneezing or any secretion could be a major hotspot. So basically they have as a 20 Meyer highlighted wearing a mask, even though it's not a droplet infection type disease. And most importantly, the treatment is symptomatic. The peculiar symptoms of headache or you could say pain in back or another thing are treated with painkillers which we call analgesics. High fever, if it appears, is treated with antipyretic, which lowers the body fever. So more or less, as we say in other viral diseases, it's mostly the symptomatic treatment, and it's always prevention is better than cure. So better safe than being sorry. So make sure the vaccination drives as well as the basic protocols are followed. So this is what we had in today's short and crisp disease in focus theories, because even though this particular disease was an important topic and was anticipated to be a almost infectious phase a couple of years back, but hopefully now the threat has substantially declined, but still it's not over as yet, because we have long way to go to eliminate or eradicate such disease. So I hope you are following your current affairs for upcoming PCS. If there is any specific topic which you feel you would like to us to cover, feel free to ask them in comment section. So we'll be back soon with another current affair lecture shortly. Keep following us on Civil Service Guru. Thank you very much. Have a nice day.